Good evening, all. Warm December wishes to all the participants. And I, Dr. Ravi Kumar, consultant pathologist working at Vijaya Diagnostics, Nagar branch, Hyderabad. Welcome you all to the continuing medical education program through our Vijaya Diagnostics webinar series. Today's topic is anti-globulin test, commonly referred as a Coombs test, presented by Dr. Priyanka Saxena. She is working as consultant pathologist at Vijaya Diagnostics, Nagar branch since a year. Dr. Priyanka has completed her MBBS from MNR Medical College, Hyderabad, and later pursued her DNB in pathology from prestigious Quaternary Medical Center, Coombs Hospital, Secunderabad. Now I request Dr. Priyanka Saxena to take over the session. Any discussion and queries will be taken at the end of the session, and I request the participants to put their queries in the chat box. Thank you. Now Dr. Priyanka will take over. Dr. Priyanka.
Thank you, sir, for the introduction. Good evening, all. This is Dr. Priyanka Saxena, and I'll be speaking on anti-globulin test. So, anti-globulin test, or more commonly called as the Coombs test, it was first described in the year 1945 by immunologist Coombs et al., and hence it is named after him. This Coombs test is two types: direct and indirect. Direct Coombs test, it is used to detect in vivo sensitization or coating of red cells with immune antibodies, that is IgG, or complements, generally C3d. It is used in the diagnosis of hemolytic disease of newborn and to diagnose autoimmune hemolytic anemias, in investigation of a suspected drug-induced red cell sensitization or hemolytic transfusion reactions. So, in hemolytic disease of newborn, there is coating of fetal RBCs by the maternal antibodies, and in hemolytic transfusion reactions, the donor RBCs will be coated by recipient antibodies. And in autoimmune hemolytic anemias, autoantibodies are seen coating the individual RBCs. Then indirect Coombs test, it is used to detect incomplete antibodies and complement binding antibodies in the serum after coating these with red cells in vitro. Now, this Coombs test is used for IgG compatibility testing and cross matching prior to a blood transfusion. It is used for screening and identification of unexpected antibodies in the serum and also to detect red cell antigens using specific antibodies, like for testing of a DU variant. Uh, Coombs test can be done by two methods: tube agglutination and column agglutination method. So the principle of a tube agglutination method, direct Coombs test, is it is a single step method. Here the RBCs of the patients which are coated with incomplete antibodies, IgG or complement components, they are made to agglutinate in saline by adding anti-human globulin reagent. And indirect Coombs test, it is a two-step procedure. Here, the presence of incomplete antibodies or C3 binding antibodies in the serum will be detected after coating them on red cells in vitro. And these sensitized red cells will be agglutinated using anti-human globulin reagent. The second method, column agglutination method, here we use an ID Liscombe cards as shown in the picture. It has 6 microtubes containing polyspecific anti-human globulin reagent and coated within the gel matrix. Now this polyspecific anti-human globulin reagent, it has anti-IgG and monoclonal anti-C3d. The cells and the serum or plasma, after being added to the reaction chamber, they are subjected to incubation and then controlled centrifugation. The cephadic gel matrix, which is present in the tube, it acts as a sieve. So the larger agglutinates of cells, they are present near or on the top of the gel interface. Smaller agglutinates, depending upon their size, they pass through the gel, and unagglutinated cells, they settle down to the base of the microtube. Materials required for Coombs test: we need a whole blood EDTA sample for direct Coombs test and a clotted serum sample for indirect Coombs test. And reagents required are normal saline, anti-human globulin reagent, Coombs control cells or check cells, 5% patient RBCs, 5% healthy control red cells or O positive cells. And for a column agglutination method, we will be requiring the Liscombe card and ID diluent tube. Equipments required are a microscope, incubator, centrifuge, a semi-automated ID centrifuge, and an ID incubator. Coming to the preparation of 5% test cells. Here we centrifuge the blood sample at a speed of 3000 rpm for 3 to 5 minutes, and this step is repeated for three times. And to the packed cells, 50 microliters of the packed cells are taken and 950 microliters of normal saline is added to make a 5% cell suspension. Now, preparation of 5% O positive cells. So, 1 ml of freshly collected O positive blood sample will be subjected to cell wash and centrifugation similarly, and this should be done for 3 times. Then, at the last wash, the supernatant is discarded, and 50 microliters of the packed cells are taken, to which 950 microliters of normal saline is added, and this becomes a 5% cell suspension of O positive cells. Preparation of 5% Coombs control cells, and these Coombs control cells or check cells, they are also used for the validation of the test. We take 1 ml of a freshly collected O positive blood sample and wash them with isotonic saline at least for 3 times. Following which, at the last wash, the supernatant is discarded. To the cell button, we add 5 ml of a monoclonal anti-D IgG reagent. This comes as a 5 ml bottle. This 5 ml, then this will be subjected to incubation at 37 degrees centigrade for 45 to 60 minutes. Then this sensitized red blood cells will be washed with isotonic saline for 4 to 5 times, and later the supernatant is discarded. To the cell button, we add 1 to 2 ml of red blood cell preserving solution. This comes as a 10 ml bottle. So 1 to 2 ml of this solution is added to the cell button. Now the completely resuspended red cells will be added back to the balance amount of RBC preserving solution. Then we get a stabilized suspension of 5% Coombs control cells. Now these cells, they have to be labeled properly with the date of preparation and stored at 2 to 8 degrees centigrade, and it has to be used within 4 weeks of preparation. Coming to quality control, for internal quality control of gel card or column agglutination method, we use O positive cells. So for positive control, we add 50 microliters of O positive cells and 25 microliters of anti-D IgM reagent. For negative control, we use 50 microliters of O positive cells, to which we add 25 microliters of normal saline. Then the card is incubated at 37 degrees centigrade for 15 minutes, followed by centrifugation for 10 minutes at 1030 rpm. Coming to external quality control or ECAS program, we participate in CMC Velo transfusion medicine 3 cycles in a year. Procedure of direct Coombs test. So we have tube agglutination and column agglutination method. So first, tube agglutination, direct Coombs test. We use 3 test tubes and label them as test, positive control, and negative control. For in the test tube, we add 1 drop, that is 100 microliters of patient 5% cell suspension, and to the negative control tube, we add 1 drop or 100 microliters of healthy control 5% red cells. Then this Coombs control cells, 1 drop is added to the positive control tube. Then these tubes will be subjected to cell wash with isotonic saline, then centrifuge at 3000 rpm for 3 minutes and decant. And this washing is done for 3 times. After that, 2 drops of anti-human globulin reagent is added to all the 3 tubes, followed by centrifugation at 1000 rpm for 1 minute, and then we have to look for agglutination after resuspending the cells. To all the negative test, whatever we get, 1 drop of Coombs control cells has to be added to the test tube and has to be looked for agglutination. If there is agglutination, it means that the test result is valid, it's a negative reaction, and we also validate the activity of anti-human globulin reagent. Now the procedure of indirect Coombs test by tube agglutination method. The similar way, we take 3 tubes, test positive control, negative control, and here we do in 3 phases: initial phase, incubation phase, and an anti-human globulin phase. In the initial phase, what we do is we take 2 drops of patient serum in the test tube, normal saline 2 drops in the negative control tube, and Coombs control cells 2 drops in the positive control tube. And a pooled O positive cell sample 2 drops is added to the test and the negative control tube. And these tubes will be incubated at 37 degrees centigrade for 45 to 60 minutes. After that, the cells and the serum will be thoroughly washed with isotonic saline, and this step is done for 3 times. And 2 drops of anti-human globulin reagent will be added to all the 3 tubes, subjected to centrifugation at 1000 rpm for 1 minute, and then looked for agglutination. Again, here we need to add Coombs control cell to the test tube in case we get a negative reaction to look for agglutination. Now the second method, column agglutination method. In this, we use the list Coombs cards and direct Coombs test. Firstly, we have to label appropriately the microtubes with the patient's name or number and centrifuge the card for 10 minutes. This is done if in case if there are any air bubbles or gel drops in the tube to remove those. Then we have to pipette 50 microliter of red cell suspension of the patient. That is nothing but 10 microliter of packed cells with 1 ml of ID diluent. In the appropriate microtube should be added. Later, this ID card will be centrifuged at 1030 rpm for 10 minutes in the ID centrifuge and look for results. Coming to indirect Coombs test by column agglutination method, similar way we have to label appropriately the microtubes with the patient's name or number, centrifuge the card for 10 minutes, and here we pipette 50 microliter of pooled O cell to the appropriate microtube. After adding these pooled O cells, we add 25 microliter of patient's plasma or serum, then subject the tube to incubation for 15 minutes at 37 degrees centigrade, then centrifuge similar 1030 rpm for 10 minutes and read and record the results. Interpretation. So tube method, presence of agglutination is a positive reaction. We have to look for both macroscopically and microscopically. In microscopy, if you are seeing aggregates composed of 3 to 5 cells, it's said to be a positive reaction. If there are no agglutination, it's a negative reaction. Then column agglutination method, positive reaction, the agglutinated cells are seen forming a red line on the surface of the gel, and a negative reaction means you see a compact button of cells on the bottom of the microtube. But depending upon the intensity of reaction, erythrocytes they can penetrate the gel to varying degrees, and these reactions are graded. So this tube shows a negative reaction where a compact button of cells is seen at the bottom of the microtube. This is graded as a 1 plus reaction where you see agglutinates present in the lower half of the tube. A 2 plus reaction, you see agglutinates present throughout the length of the tube. 3 plus aggregates or agglutinates, they are seen in the upper half of the tube. And this is a 4 plus reaction where you see a thick line on the surface of the gel. Now, why do we need to do these things? Incubating RBCs with antisera is done to give time for antibody molecules to attach on the antigens on RBC surface. And a minimum of 3 saline washes has to be done to remove any free globulin molecules. Anti-globulin reagent is added to form RBC agglutinates. Centrifugation is done to accelerate the process of agglutination by bringing the cells closer together. And agglutination has to be examined to interpret the result as positive or negative. Grading is done to determine the strength of reaction. So the degree of agglutination, it directly correlates with the degree of hemolysis in the patient. So grading is done to determine the strength of reaction. And antibody coated RBCs are added to negative reaction just to validate the test and to see whether there are any check for neutralization of antiserum by free globulin molecules. Sources of error in Coombs test. False positive results can occur if there is agglutination of RBCs before adding of anti-human globulin reagent, when you do over centrifugation of the tubes, if there is dirty glassware, then if there is contamination of anti-human globulin reagent with proteins, presence of cold or autoantibody in the sample, using of improper sample like clotted cells used instead of EDTA for direct Coombs test, presence of spontaneous agglutination. This happens when the cells are heavily coated with IgM, and non-specific agglutination. False negative results occur when there is inadequate washing of the cells, there is delay or interruption in the washing procedure, failure to add anti-human globulin reagents, under centrifugation, too heavy or a weak red cell suspension, when there is insufficient incubation, prozone effect, or anti-human globulin reagent that has lost its potency. Now, this prozone effect is nothing but a false negative reaction which occurs if there is antibody excess in the sample. These antibodies, when they are in excess, they will neutralize the antigenic sites on the RBCs, thereby preventing their agglutination and giving a false negative reaction. So by this, I conclude my session. Thank you for patient listening.
Thank you, Dr. Priyanka, for a detailed and educative presentation. Now, I welcome any queries regarding the topic of discussion. request participants for any queries to be put up in comment section. I think there are no queries, so we'll end up the session. But before ending, I would like to thank the management of Vijaya Diagnostics and our lab director for giving us the opportunity. And I also would like to thank our supporting team, branding department, Mr. Sai Krishna, IT department, and marketing department for helping us to successfully present this webinar. Finally, I thank all the participants for the time and involvement. Thank you, one and all.